our hospitals fill up more with COVID patients, and I've asked our Department of Public Health to give us regular updates. There's too much virus circulating in our community. There's too great a risk to not get vaccinated, and please wear a mask. Today we have with us Spring Schmidt, our Deputy Director of our Department of Public Health in St. Louis County, who will review the most recent data for us. Spring?
Thank you. So a couple of things that I want to talk about today is one of the numbers that we start with most often. So this is the rolling average of daily cases. We do use a rolling average in order to smooth out those cases over the last 7 days so that any individual daily spike doesn't make us concerned one way or the other. We look for something that actually smooths out those numbers. So right now, St. Louis County is averaging 283 cases every day. And we have been on a bit of a flat trajectory for about 6 days in a row in which we have not had any significant rising increases, a couple of small decreases. However, this is still significantly high in comparison to some of what we're seeing around the country, and it puts us pretty squarely at a really high rate of transmission for St. Louis County. And I would also say that that's not quite enough to predict a trend yet for which way this number is going, except that for right now, there is still a lot of virus and active cases circulating in our community. In order to talk a little bit further about the types of things that we're seeing and why we consider this to be high transmission, we use some of the thresholds that the CDC has put out. They use a slightly different metric, so we also want to make sure that we recognize that metric too. The number of cases cumulatively over the last 7 days, so the whole last week's worth of cases, divided by 100,000 people. So for St. Louis County, that is currently 171.3 per 100,000 people. According to the CDC's threshold matrix, as you can see on the right, that puts us pretty firmly in the very high transmission category. We also have talked a lot over the course of this pandemic about the positivity rate. That shows for the number of tests that are being conducted in St. Louis County, how many of them are turning out positive for county residents. And right now in county, that number is 11.8. Like ideally, we want to see that number be below 10, and we certainly would like to see the lower the better. Because that means that testing is adequately capturing the number of people in the community at any given time that are likely to have the virus. A high positivity rate often means that that our testing may be too low, which means there's some folks out there that we would probably really encourage to get tested, and also that there is a significant amount of virus circulating in the community if a lot of people that are coming and thinking that they need a test are turning out to be positive. One of the next things that we want to look at is we've been talking about why we've been prioritizing a lot of our communication related to children. So right now, for all of those positive cases every single day, about 1 in 5 of them is a county resident under the age of 18. So we are seeing a substantial amount of transmission and spread amongst children in St. Louis County. We did not experience that at this level last year. The Alpha variant and other things that we were experiencing in our community were transmitting differently among children. That is not currently the case with the Delta variant. So as we look at why we're talking about children in this, and we've also been talking about geography. And so this is a map of the most recent cases of the last 14 days in St. Louis County. And so you can see there's geographic variability across the county and where we are seeing some of our new cases pop up. So there's quite a bit in North County, particularly outer North County, over the last 14 days, as well as some pockets in deep Southwest County as well. So it's very important that you see that there are no geographic areas of the county where there is no spread at all, but there are differences at any given time over where we see some of the most significant spread. On the next slide, one of the things that you'll also see is where we are in terms of vaccination. Now, this is incredibly important. St. Louis County does have the 3rd highest vaccination rate in Missouri. However, Missouri has one of the lowest vaccination rates in the country, so we are still struggling in terms of what it is that we're trying to see move forward for vaccination. So 53% of county residents have initiated a first dose of any COVID virus vaccine, and 47% are fully vaccinated at this time. We have been seeing this number increase. I will say these are pretty modest increases. So overall, countywide, 5.7% of an increase over the last 7 weeks. However, one of the things we are excited about is because we have been focusing on those areas of where we see some of the most disadvantages, we've been prioritizing North County. We've been talking about that pretty significantly. We've been prioritizing in particular 6 zip codes in inner North County that had our lowest vaccination uptake. Our efforts in that area are paying off because those vaccine uptake rates have increased by 7.5%. At the same time, the rest of the county was increasing at 5.7%. So vaccine uptake is happening faster in inner North County than it is across the rest of the county. But you can also see by these numbers, they're pretty modest, and we've still got a long way to go, which means our efforts just cannot let up at this time. So we have also been talking about the geographic spread of where we have been seeing people vaccinated as well. So this is also a map that you can see here of the percent of individuals who have received at least 1 dose of vaccination. So there are also geographic differences. If you would look at this map in comparison to the one I showed a few minutes ago, you would also see that this is an inverse of new cases for where we do see some of our lowest rates of vaccination. So areas that are unvaccinated are having higher rates of transmission more than the rest of the county is. Those are correlated with each other. The majority of cases that we're seeing are among the unvaccinated. We have also been seeing an increase in vaccinations among children ages 12 to 19 who are currently eligible for that. However, this is also quite a bit lower than what we're seeing in the rest of the county. So 42.9% of children ages 12 to 19 who are eligible for the vaccine in St. Louis County have initiated at least 1 dose. So that is still very concerning to us, especially considering that we are really looking forward to the start of a school year within the next week or 2 weeks for most St. Louis County children, and we want to make sure that we can increase that vaccination rate in order to keep that as protected as possible as we move forward. So our vaccination rates among our children are lower than it is for the rest of the population. We have also been seeing racial differences in the uptake in vaccinations among our children. We partnered with SLU, who has been working with us to analyze a significant portion of our data and provide some additional bandwidth to our team. But they have been calculating the uptake rates among children by race. And so for ages 12 to 15, you can see that there is a pretty significant difference in the initiation of vaccine among our young African American residents in St. Louis County versus white or Asian residents in St. Louis County as well. So there is a difference in uptake. And so there is a lot of conversations that need to happen among families, among community members, among medical providers, and those that they treat in order to have good conversations about the value of vaccination. The last thing that I want to talk about is you may have heard a lot of things about breakthrough cases in this. You are 3 times currently more likely to catch COVID if you are unvaccinated. Yes, we have had some breakthrough cases among the vaccinated. Those are mild. They very rarely result in any severe disease or hospitalization or death, very, very rarely. But they also do prevent a lot of catching COVID out in the community when the transmission is this high. So you are 3 times more likely in St. Louis County right now to catch COVID if you are unvaccinated. So when we put all of these things together, these are a dashboard of the kinds of things that the Department of Public Health looks at every day and see how these things change over time. We do look at a lot of other things too, but these are some of the most relevant statistics that we watch all the time to try to identify what the state of our community is. We are focusing right now on schools. We are headed into back to school. We've been working very hard with superintendents and school nurses and school staff to provide good mitigation advice about how school can be as safe as possible as we enter in. But it is important that we tell everybody that the Delta variant is different. Kids are catching and spreading COVID, both within school and then back to their families or other people in their community at a rate we did not see last year. It is different. Masks prevent COVID. So does distance, airflow, and vaccination. And we have been having strong conversations with all of our school leaders about their ways in which they can do that to keep kids as safe as possible. Low COVID cases help keep kids in school, help keep parents at work, and help keep our community kind of moving forward in those very important issues. We do expect an increase in school-related cases. We will see additional outbreaks, just given the sheer volume of the number of kids that will be going back to school. But we do feel like our schools have strong mitigation practices and are working hard to keep those as vigilant and diligent as possible as we move forward. But we do have to have a lot of strong conversations about how all eligible children, as well as all of the adults that are interacting with them, do get vaccinated in order to keep that environment as safe as possible. DPH, as I said, does continue to focus on community outreach, communication, and local neighborhood clinics in North County. That 7.5% increase in those 6 target zip codes is something that we're very excited about, even if they are modest increases, because those are the results of a lot of individual conversation, grassroots work, boots on the ground, Department of Public Health staff, and all of their community partners working individually with people to talk to them about these opportunities. The lowest rates of vaccination are in those areas, and that's where our focus is. We've been hosting neighborhood clinics across St. Louis County. We have done 116 clinics with 69 different locations. The vast majority of them have been throughout North County. That's been our focus so far. The misinformation that's out there is hurting all of us. And here's what we think that you need to know. Vaccinated people are 3 times less likely to catch COVID. Please get vaccinated. If you are vaccinated, you are 10 times less likely to get a severe disease, hospitalization, or death. The pandemic has changed. The science is adapting with it, and we are making our modifications change to be as responsive to where we are right now. We cannot stress enough how important it is to get vaccinated, get tested, and wear a mask. Thank you.
Be glad to answer any questions.
Yeah, I've got a couple questions.
Sure.
Ty Hawkins, Fox 2 News. Can you defend the use of $2 million of taxpayer money for the Fenton Communications PR contract?
The communications is a really important part of our vaccine strategy. We need to educate folks in the community about the value of our public health response, about the danger of COVID. And that communications contract is similar to what you see in other parts of the country when the local public health officials are making an extraordinary commitment to getting people engaged in the conversation around vaccines, around wearing a mask, and all the things you need to do to protect yourself and your loved ones. It's a small amount of the overall funds that we have to spend in our community to help people, and that extra effort by our health department is something we're very proud of, and that's why you're seeing an uptake in vaccination rates in our most vulnerable areas.
Okay, look, $2 million is a lot of money. How do you answer critics who have reviewed the Fenton contract and say it appears to be an effort to use taxpayer money to get you reelected?
Well, I think anytime you're involved in government, there will be political accusations, and that is a political accusation. But I think you need to go back and look at the fundamentals. COVID is serious. We have vulnerable communities that need extra help in communication, and you've seen that effort with our North County Outreach Group, with our community stakeholders group, with our community partnerships, with our door-to-door efforts, with our mobile campaigns, with print advertising, TV advertising, and radio advertising, which is the vast majority of where those funds go. But I expect as we get closer to next year, when we get closer to the campaign cycle, that we will see more political accusations. They've already filtered in a very partisan way in some of our public health conversations and some of the discussions around public health orders and protections and masks and vaccines.
Do you feel the county got full value from Fenton Communications on this contract?
Well, we're still in process of implementing that contract, but I do believe that it's important for St. Louis County to make an extraordinary effort to tell people about masking and how it saves lives, because these public health recommendations are what keeps our kids in school, keeps them in the classroom, keeps our businesses open, keeps our economy going, and we have to get our vaccination rates up. Missouri is one of the lowest vaccinated rates in the country, has one of the lowest vaccination rates in the country. Our cases are climbing as fast as just about anywhere in the country. In fact, we've remained in the top 3 or top 5 states for case counts for a long time. And we need to be doing everything we can to get the word out on how to protect our community. So that education effort is important. The communications campaign is important. And folks will look at that number and they'll try and politicize it, just like masks are politicized and vaccinations are politicized. And that's where we are as a country, and it's unfortunate. We're there, we're going to fight our way through it, we're going to protect our community from COVID as best as we can.
You mentioned local economy and businesses, but how come this was only offered, this contract only offered to, it wasn't offered to any Missouri or St. Louis area firms? It was contracted out with taxpayer money to New York City, a New York City firm.
Yeah, well, there's always, whenever there's a contract given in St. Louis County for anything, whether it's or any government for that matter, whether it's a road or a service, there's always complaints from the folks who didn't compete for it, didn't win it, and that's the nature of competition in our country, and it's the nature of competition around government. And that happens no matter what the contract is. There will always be criticism by folks that didn't compete for it or didn't receive it. The professional people in our health department determined who could provide the best service. And like everything in county government, I leave the awarding of contracts to the people who have professional expertise and let them make those decisions.
Okay, so do you leave the hourly wages that an intern is making and a receptionist is making? A receptionist is making $85 an hour and an intern is making $55 an hour?
If you have any more questions about this, we can do it offline.
Please
This is
go
about,
ahead and answer that one. That'll be last.
You know, I don't know about the details of the contract. I don't know that the statements that you're making are representative. I understand that this is politically charged, and I appreciate your commitment to this topic, and I wish you the best. But I do believe that this contract has tremendous value, that COVID is very serious, that politicizing individual contracts, politicizing masks, politicizing vaccines don't help our community. What helps our community is for people to get vaccinated, for folks to recognize that masks help save lives, that we need to keep kids in in-person school, and we need to be working together. And if St. Louis County, if the professionals in the health department and otherwise in St. Louis County have decided that they want to make an extraordinary effort around communications, then I support their professional decisions. The details of the contract, I'm sure that folks that want to make politics out of it can pick through it and find things to disagree with. That's what happens in government, whether it's in St. Louis County, whether it's in state government, or whether it's in the federal government.
What did the taxpayers get from that $2 million contract?
that was,
Thank you.
that was the final question.
Any
Does anyone have a
tangible
question for Spring on the report today? Otherwise,
Any tangible results from that $2 million?
I was just gonna ask about, has the health department ever thought about the third shot or the booster?
Oh, the boosters? Yeah, I'll let Spring explain the boosters. Yeah, there's a lot in the news. There's a lot in the news around boosters, and I think it's an evolving topic right now.
Yes, so of course, last week when they made the announcement recommending that there would be third dose boosters available, or they recommended them for those who are moderately to severely immunocompromised, our clinical teams got together, reviewed the information that was out there. We spent the weekend updating our forms and documentation and our clinical procedures, so we are ready and currently doing that and available for people who are fit in that category. And so that is currently happening at the health department. Obviously, we're watching the news on the recommendations that may come out soon on a third dose booster shot for everyone at kind of an 8-month cycle. So we are waiting for those official recommendations, because sometimes the federal government makes some specific clinical recommendations or timing recommendations that it helps our clinical staff to make sure that we get them completely correct. But we also launched some additional planning services this weekend for what to do if we do start to do some third dose boosters for a larger public, because we've been vaccinating for a while, and we expect that some of those folks that got vaccinated earlier this year will want to take part in that. So we've already started our preparations for additional mass vaccination events or community clinics, or rolling up our own clinics in order to be able to meet that need if the federal government advises it. We want to be responsible for whatever the advice is on how we can best protect people with vaccines.
Any word on the FDA?
Any word on the FDA piece? No. Sorry. So we know that they're reviewing for the final approval for all of the current vaccinations that are up there. We think that it's going to come at some point this fall. We also currently are awaiting sort of whether they will expand to ages 5 to 11 to increase vaccinations among children. We know that is also under review. So we do wait, like everyone else, for the federal government to make those moves. I'm afraid we don't get any particular insider information on that, though.
Anyone else? Thank you.
Thank you.
Thanks.